same lines. I am always a huge popliteal block fan. You know, it's one of those unbelievably satisfying blocks.
I do most of them popliteal as well as the sciatic at the supragluteal level.
Lower limb, my favorite block has to be the adductor canal femoral triangle block.
I do lower limb. I still like the ankle block. You know, it's obviously not one of our plan A blocks, but it's a lovely block to teach and to do. You know, you've got at least 3 nerves you'll block with the ultrasound.
My favorite one is probably the sciatic nerve block at the popliteal crease, because I think it can provide a lot of good analgesia for a wide range of surgical procedures.
Femoral. I just love femoral.
I think the IPAC block. Now, for me, the IPAC block has been the biggest game changer for knee analgesia for total and uni knees.
I love the ankle block. Does that make me a little bit unusual?
For lower limb block, I think you really have to look at arthroplasty as the primary mover, I think, for lower extremity surgery. And for that, I would recommend the adductor canal block or distal femoral triangle block.
It's got to be the IPAC and adductor canal combination for major joint knee surgery. I love that. And I think
lower limb is probably going to be the popliteal block, but that's because I do lots of foot and ankle work and foot and ankle anesthesia.
Lower limb, I think, again, for teaching purposes and also for patient purposes, I think that a popliteal sciatic, at that point where the sciatic divides, is a really lovely block to teach. It's great for teaching needling technique. And it's one of those blocks that can really get you out of a hole when you've got one of those patients who is just not a GA candidate.
Yeah, I actually have to say I have a soft spot for the femoral nerve block, which is a little bit sort of a forgotten block.
Which is the PANG block, a superior capsular nerve group block, and the CFU, the suprainguinal fasciolae block.
So lower limb. I love popliteal because I do a lot of complex foot surgeries. But if I have to choose a favorite, it's going to be IPAC because it had completely changed my practice.
Favorite, most practical, versatile, best lower limb block ever in the world is the wait for it, is the popliteal sciatic nerve block. I mean,